I think a common problem in orthopedics is doing an evaluation that only looks for information that would rule in a diagnosis and not looking for things that would rule it out. Those are two different ideas. Some of it can be maybe assigned to confirmation bias, but some of it I think is also due to lack of time, maybe ignorance, and maybe a subconscious understanding or conscious understanding that if you found other things that rule what you think it is out, you wouldn't know how to proceed or you wouldn't know how to treat it. I think this is especially prevalent when it comes to shoulder complaints, but it could be for other joints and other problems as well. A common example, or something I think of a lot with the shoulder, is that people are told they have a rotator cuff problem or an impingement problem, when yes, they have a painful arc. Yes, they have painful abduction. Yes, it hurts to lie on that side. Those things can rule in those scenarios, of course. But if your evaluation also includes, testing neck range of motion, thoracic range of motion, the other shoulder range of motion and strength, and also looks at nerve tension and distal strength in terms of biceps, triceps, wrists, and thumbs and fingers, you will find stuff in a lot of those patients that would make you think twice about ruling in a rotator cuff problem or impingement that's local to that shoulder joint. I actually don't find that diagnosis very often. It's not very often I come across a tendinopathy, because you find so many problems that are tweaked joints in the neck, thoracic spine, and shoulder will present with those three things in conjunction likely with other things. What I find a lot is there's going to be some kind of distal or painless weakness. If there's a tendinopathy, I would expect any weakness in that tendon to be associated with pain, but you'll find distal thumb weakness or finger weakness or wrist extension weakness, or maybe you'll find positive nerve tension or triceps weakness. Of course, if you found limited range of motion in the neck, especially if it's painful and especially kind of if it's going to that side or going into extension, that's another sign that would make you think, oh, there's probably something else going on here. Again, I don't think a lot of clinicians, or I know a lot of clinicians, are not doing that shoulder evaluation and then coming away from the baselines and the verbal history and thinking to themselves, let me do repeated movement testing of the neck. That is, of course, because not many clinicians have ever learned repeated movement testing of the neck. I think it's the most important test I use, but if coming out of the verbal history and the baseline taking, I'm starting to think it is a tendinopathy, I will do a different test likely than if I think it's coming from the thoracic spine or if I think there's a shoulder joint derangement. So my point is just, if you go just by things, a limited number of things that rule something in, then you're being premature about what diagnosis it is. You have to look at everything. You have to not come into it with a bias. Look at the other extremity, look at the spine, look at the distal parts of the upper extremities, nerve tension. And once you get every piece of the puzzle, you have to ask yourself what it sounds like. Now, if you don't have the vocabulary or kind of the paradigm to understand that I've seen hundreds and hundreds of people with tweaked joints in their necks with painful arcs, pain lying on that side, resisted abduction is weak and painful, triceps extension weakness, maybe thumb extension weakness, and definitely quite often neck limited mobility and or painful limited mobility, or in the thoracic spine. If you don't have that understanding that kind of presentation exists, and those people will likely respond to moving the neck in a specific direction or moving the thoracic spine in a specific direction, I feel like that's why you don't look for those signs and symptoms, because you wouldn't know what to do with it. You wouldn't know what that diagnosis is. If you took all those things and you would say, oh, well, it's rotator cuff impingement, tendinopathy still, and you have by chance wrist extension weakness and thumb extension weakness on that side, and the opposite side has triceps weakness and limited functional internal rotation, and you would just kind of maybe assume that those are unrelated. To me, everything is related until it's not. And to me, that's a very common presentation where a joint is deranged in the spine and it's presenting with lots of signs and symptoms. Some of them are painful, some of them are not, into the upper extremities.